So again, this is very important for everyone to understand that medicines, it is easy to start the medicines, but it is difficult to stop them. In many of my cases, I do start this medicine after 6 months or 1 year. I have been doing transplants for more than 20 years now, and most of the times when I see someone, we can detect that this is a transplant. And be it all the big shots in Bollywood or even Hollywood, or cricketers, actors, it is very much visible that they have done a transplant, or they hide it with the help of some powder topic. But what I notice consistently in my patients, that we cannot detect that it is a transplant. When I see my patients, I cannot tell that that is a transplant, and that is without any camouflage of powder, or with minimal or no camouflage of medicine, because even medicines can grow a lot of softer hair in the hairline zone, which creates an illusion that it's a good transplant. It fills the gap, and those softer hair look so natural in the hairline zone that the patient thinks, wow, it is awesome. But it is not. So when you are doing transplants with small doses of medicine or no medicine, you actually need the right skill set to execute it, and the technique and everything. So tell me one thing, what is the dosage of medicine you are taking now?
So currently I'm taking Finax once a week, 1 mg once a week, and I was using
Minoxidil.
minoxidil,
Hmm.
but
You have
of
stopped
late
it.
I have stopped it. Yeah.
So that means you are mostly on 1 mg per week finasteride.
Right, correct.
Okay. So that's a very small dose. And did you notice any side effect or something with the medicine?
Not at all.
You have been taking it for last 4 years now?
Yes, I have.
So again, a very important point to note here is that the medicines can cause problems, the side effects. Then there is dependence on medicine, and there is an issue of tolerance with the medicine. So you know what? We gave you microdosing, and the reason why we gave you this medicine was to slow down the progression of disease and to make sure that the transplanted hair grow in thickness. Now, when we did this transplant, do you remember we discussed all these things beforehand?
Right.
Huh?
In fact, you had prescribed Finax much later.
After transplant?
Yes,
How
I
many
think
time? How much time?
much later. It was at least 6 months later.
6 months after the
Yes,
transplant.
yes,
Oh,
yeah,
so that again is the min-med approach which we follow,
yes,
where either we don't start the medicine, or if we start, we titrate the doses and start with the smallest possible dose.
yeah.
So in many of my cases, I do start this medicine after 6 months or 1 year. In one of my colleague only, he is my transplant technician. I started this medicine around 6-7 years later after the transplant. So again, this is very important for everyone to understand that medicines, it is easy to start the medicines, but it is difficult to stop them.